When most people hear the term digital health, they probably think of things like electronic medical records, online lab results, or video calls with a doctor. And that's understandable because those are some of the most visible ways technology has changed healthcare. But digital health is actually much bigger than that. Essentially, it's about using technology and data to change the way healthcare works. Sometimes that means making information easier to access. Other times, it's about helping healthcare professionals make better decisions. But ultimately, it's about giving patients the opportunity to play a more active role in managing their own health. The interesting part is that a lot of these factors are already happening outside of traditional healthcare settings. We don't necessarily have to walk into a hospital or doctor's office anymore for health information to be collected. And that's really where digital health starts to become something more than just putting healthcare on a computer. It's about changing how healthcare connects people, information, and technology. So let's elaborate a little bit on the term digital health. Think about how much information your phone or smartwatch can collect without you really having to do anything. It can track your steps, your activity, your sleep, and in some cases even things like your heart rate. On their own, these might seem like pretty basic measurements. But imagine taking that information and looking at it over several weeks or several months. Suddenly, you aren't just looking at one number, you're looking at a whole pattern. That's one of the key ideas behind David Rowland's description of digital health. It's not simply another name for eHealth or health information technology. It's a broader shift in the way healthcare operates in a digital world. And part of that shift is recognizing that healthcare doesn't only happen inside hospitals and doctors' offices anymore. They happen at home, they happen at work, and they happen while we're exercising, sleeping, eating, and going about our everyday lives. And the more technology becomes part of those everyday activities, the more opportunities there are to understand what's actually happening with a person's health. But collecting all that information creates another problem, because having more data doesn't necessarily mean you understand what's going on. For a long time now, healthcare was largely built around snapshots. You would see a doctor, have your blood pressure checked, and maybe get some blood work done, and that information would become part of your medical record. The problem is that those measurements only tell us what's happening at a particular moment. Nowadays, wearable devices and remote monitoring start to change that. Instead of getting one measurement during an appointment, a device can potentially collect information throughout the day. Heart rate, sleep, physical activity, blood pressure. Now, instead of looking at isolated moments, healthcare professionals can start seeing changes over time. That single unusual reading might not mean much by itself, but if something continues changing over several days or starts to follow a particular pattern, that makes things different. It could allow a healthcare professional to notice something earlier than they otherwise would have. So digital health isn't simply giving us more information, it's changing the timing of that information. We're moving from occasionally checking someone's health to potentially having a much more continuous picture of it. But the thing is, once you have that much information coming in, the next challenge becomes pretty obvious. Because someone, preferably a professional, has to make sense of it. Because a heart rate is just a number. By itself, it doesn't tell you very much. But add other factors such as blood pressure, oxygen saturation, temperature, medications, lab results, or a person's medical history. Now that same heart rate starts to mean something completely different. And this is exactly where data analytics becomes so important. Digital health systems can take enormous amounts of information and look for relationships and patterns that would be difficult to identify manually. And increasingly, artificial intelligence can help with that process as well. For example, a small increase in heart rate might not seem particularly concerning on its own. But if that increase is happening alongside low oxygen levels and a history of heart disease, the situation looks very different. And this is where human judgment comes in. The technology isn't necessarily making the final decision. What it's doing is helping bring the relevant information together quickly enough for a healthcare professional to actually use it. And that distinction is very important, because the goal isn't to collect the biggest possible pile of health data. The goal is to turn that data into something useful. It's easy to look at digital health and focus on the technology itself. And of course, the technology does matter. But technology doesn't operate on its own. Its impact depends on how people use it, how well it fits into healthcare, and whether it actually helps patients and healthcare professionals. Anne Snowden describes digital health as a way of empowering individuals and communities to take a more active role in managing their health while working alongside healthcare professionals. Instead of healthcare being something that simply happens to a patient, technology can give the patient more information and more opportunities to participate. Someone managing diabetes, for example, might be able to monitor their blood sugar, share that information with their healthcare team, and make changes before small issues become much bigger ones. And this is where we need to move beyond the technology itself, because introducing a new digital health system isn't simply a matter of adding the process and expecting everything to work. The technology itself changes the way people work. It changes workflows, it changes communication, and it can change how decisions are being made. This shows that digital transformation isn't just a technical problem. It's also a human problem. This is where models, theories, and frameworks become useful, as they offer different ways to make sense of the challenges of digital health. And one of the first challenges we encounter is people. For example, a healthcare professional might have to learn a new electronic system. A patient might have to use an app to manage their health. A wearable device might be introduced to collect more information that can be shared with a healthcare team. But the thing is, people don't all respond to new technologies and systems the same way. Some people see a new system and immediately want to figure it out. Other people look at it and think, why are we changing this? The old one worked perfectly fine. And neither reaction is particularly unusual. To make sense of this, a theory called the Rogers Diffusion of Innovation theory helps explain why people adopt new technology at different speeds. Some people are early adopters, others need more time, and some may be hesitant because they're worried about making mistakes, don't trust the new system, or simply don't see a reason to change what they're already comfortable with. In healthcare, this is an important factor to think about, because you can't just introduce a new system and expect everybody to suddenly become comfortable using it. There needs to be training, there needs to be communication, and there needs to be support while people figure out how the new system actually fits into their work. Because even the best technology can fail if people using it don't understand it, don't trust it, or don't feel comfortable using it. But people are only one part of the equation. Even when people are ready for change, the system itself still has to be implemented properly. And that brings us to the systems lifecycle model. This model gives us a way of thinking about the process of implementing a digital health system from beginning to end. Before introducing a system, whether it's adding a new device, software, or workflow, we first need to understand the existing environment. So let's ask ourselves, what problems are we actually trying to solve? What are the needs of the people who are going to use the system? And is the organization actually ready for change? From there, we can plan a solution, develop or purchase a system, and test it before implementation. But here's the part that's easy to overlook. Implementation isn't really the end. Once the system goes live, people start using it in the real world, and that's when you may discover things you didn't anticipate. Maybe a workflow doesn't make sense. Maybe users are struggling with a particular part of the system. Maybe the organization itself has changed. So the system needs to be maintained and evaluated over time. And that brings us to another important reality of healthcare. Not every problem we encounter will have a clear or predictable solution. See, healthcare is complicated. Sometimes the problem is straightforward. Sometimes it requires an expert. And sometimes, even after we've analyzed everything we can, we still don't know exactly what will happen. And that's where frameworks like the Cynefin framework become useful. It gives us a way of thinking about different types of situations and choosing an appropriate response. A simple problem is one where the relationship between cause and effect is clear. You can follow an established procedure and get the expected result. A complicated problem is different. You may need expertise or analysis to understand it, but there is still an answer that can be eventually determined. Complex situations are much less predictable. You may have an idea of what will happen, but you can't be completely sure. So instead of relying on one fixed solution, you experiment, observe, learn, and adjust. And then there are chaotic situations. Something has gone seriously wrong, and you don't have the luxury of waiting for a perfect understanding of the problem. You need to act first to stabilize the situation. Now, the reason this matters in digital health is that organizations can't treat every problem the same way. Sometimes it requires standard procedure, sometimes an expert, other times you have to experiment, or sometimes you just need to simply act. But whichever situation you're dealing with, there's always one thing that remains constant. People learn from their experiences. Healthcare professionals don't stop learning when they graduate. A lot of what they learn happens through experience. They encounter a situation, they think about what happened, they reflect on what they could have done differently, and eventually they take that experience into the next situation. And that's essentially what the Kolbs experiential learning theory describes. It's a cycle of experiencing, reflecting, thinking, and acting. And there's an interesting connection here with the DIKW model: data, information, knowledge, and wisdom. Because data is the starting point. A heart rate, for example, is simply data. Once we put that data into context, it becomes information. When that information is understood and connected to what we already know, it becomes knowledge. And eventually, that knowledge can help guide a decision. But then we reach wisdom. And this is where technology has a limitation. Because a computer can organize information. It can identify patterns. It can even suggest what might be happening. But it doesn't experience the patient the way a healthcare professional does. It doesn't understand the entire human situation behind the numbers. A healthcare professional still has to bring together the information, their experiences, their clinical judgment, and the patient's individual circumstances. And that leads us back to the big picture. Digital health isn't really about creating a healthcare system where technology does everything. It's about creating one where technology can do more of what technology is good at, while people continue to do what they're good at. Technology can collect information continuously. It can organize enormous amounts of data, identify patterns, it can connect patients and healthcare professionals, and it can give people better information to work with. But healthcare still depends on judgment. It depends on experience, it depends on communication, and it depends on the ability to understand a person behind the data. And that's why the future of digital health isn't really a choice between people or technology. It's about getting the two to work together. The technology gives us more information, more connectivity, and more possibilities than we've ever had before. But what we do with those possibilities still comes down to people. And ultimately, that's what digital health is really about. Not replacing the human side of healthcare, but using the technology to make the human side of healthcare more connected, more informed, and hopefully better for the people receiving it. So thank you so much for listening. That concludes our video. Don't forget to like and subscribe. And if you have any questions or comments, please write them down on the comments field below. All right, you have a great day. Take care. Bye-bye.